Hi everybody. So in today's reel we're going to talk about different attitudes in breech presentation. So we have our breech baby here. Okay, the baby is in breech presentation. Okay, and the first type of breech is called a complete breech. So there are basically two types, complete and incomplete breech. In a complete breech there is flexion, it's also called a flexed breech. There is flexion at the hip joint and there is flexion at the knee joint. So this is a complete breech, flexion at the hip and flexion at the knee, which I will just show you. It's like this. So flexion at the hip and flexion at the knee is called a flexed breech or a complete breech. Then we have incomplete breech. And in incomplete breech there are three types. The first is a frank or an extended breech, which is the most common type, and this is like this. So you have flexion at the hip joint and you have extension at the knee joint. Then you have this. What is this kind of breech? This kind of breech is a footling breech, okay, and where you have extension at both the hip and the knee joint. Then you have something like this. This is the third type of incomplete breech. This is called a kneeling breech, where the knee is the presenting part. So you have extension at the hip joint and flexion at the knee joint. So you have, I'll repeat, you have a flexed breech or a complete breech. Then you have incomplete breech, which could be a frank or an extended breech, which is the most common. Then a footling breech and a kneeling breech.